Hello and welcome everybody. I am Dr. Saif Ali. This is Oral Surgery channel, and this channel would be dedicated for the subjects of oral surgery. And today we have a case of surgical extraction of impacted upper canine. This is a panoramic view of the case, showing that the tooth is horizontally impacted, extending from the central incisor to the first premolar at the right side. This is an axial view of the tooth, and this is a cross-sectional view showing that the tooth is palatally impacted and covered by some bone and its relation to the root of the central incisor. This is a 3D view. We are seeing the tooth through the mandible, and this is a frontal 3D view for the impacted tooth. The instrument that will be used in the operation: first we have the scalpel, which consists from the blade handle number 3 and the blade number 15, and a preosteal elevator. In this time we use Krakosa preosteal elevator from IDM, which is a very sharp and efficient instrument, and finally surgical handpiece with surgical round beam. The case is anesthetized by distributing local anesthetizing agent throughout the plate, and now we start our incision by inserting our blade in the sulcus of teeth, cutting around the sulcus of the teeth, and we should be sure that we are always touching the bone in order to get a full thickness mucoperiosteal flap. This will prevent tearing of the flap and also will prevent damage for any blood vessels or nerves. The line should be continuous, and we will extend the flap from the first premolar at the right side to the lateral incisor on the left side. Now the next step is reflecting the flap by using periosteal elevator. We use the pointed end, we run it through the incision line and use a slight elevating movement to get a primary elevation. After that, we use the broad end of the periosteal elevator, making sure that the convex surface always toward the soft tissue and the concave surface always touching the bone. After getting primary elevation, we can insert a piece of gauze under the flap and push on it with a periosteal elevator. This will give us more uniform reflection of the flap and would control the bleeding at the same time. We can repeat this process more than one time. Now the structure I'm pointing to with the periosteal elevator is the incisive bundle that consists of the incisive nerve and vessels that run through the incisive canal toward the palate. Sometimes it's impede the elevation of the flap and it needs dissection. Now we will dissect it using blade. We can use a scissor or a blade to dissect the bundle and get better reflection of the flap. Repeating the same trick, using a gauze and pushing on it with periosteal elevator. Now what we are doing is called marking of the site of the crown. This is done depending on the CBCT image. We place a mark on the bone where we expect the crown of the tooth is there. This time we are using a sharp probe, but I usually use a surgical canine. I use the pointed end. It is much sharper and can penetrate much deeper, and even it can remove the entire bone covering the crown. After marking the site of bone removal, we start bone removal using surgical round bare and copious amount of irrigation. We are not cutting deep, only superficial, to reveal a part of the crown to confirm our site of bone removal. As you are removing bone, you can feel the tooth. It is much smoother and much harder than the surrounding bone. Okay, we dry the area with using piece of gauze. Now we can see the a part of the tooth. I'm pointing it with the periostal elevator. This is confirmed by first the color. It is a bit yellowish, while the surrounding bone is white, and it is smoother and harder than the surrounding bone, which is rough and porous. The next step is removing the bone covering the entire crown. We should reveal the entire crown. I always use the tooth as my guide, never cut deep, always superficial, extending from the tooth out. In this way, I'll protect the adjacent roots from being damaged by iatrogenic cutting through them with the surgical bare. More of the tooth being revealed. In this screenshot, we can see this is the tooth and this is the surrounding bone, and we need to remove more bone in order to uncover the entire crown of the tooth. So more bone is removed. Always keeping cooling with the normal saline. It's important to prevent bone necrosis. Now the entire crown is uncovered, and we can start the next step, which is sectioning of the crown. We separate the crown from the root. This will minimize the amount of bone needed for extraction of the tooth. We can use turbine with a long tapered Fisher bare. Carbide ones are better than diamond. We are not cutting deep. We only want to create a slot in the crown that we will fracturing with an elevator, an apixo, or a crier. Now we will introduce a crier elevator into the slot and fracture the piece of crown, and now we are left with only the root of the tooth. Now we will start a process called guttering, in which we will remove bone surrounding the root in order to create space for an instrument to luxate the tooth. So much instrument in very little space, so unfortunately we couldn't capture it in motion, but this diagram illustrates what is going on. You remove bone surrounding the root. It is better done with a surgical Fisher bare, small surgical Fisher bare, in order to create space to luxate the tooth. Always using irrigation. Okay, now the crown is luxated using a pixel elevator. and we grab it with tweezer. The tooth is refusing to get out of the mouth. Finally, now we will irrigate the extraction site in order to remove any debris created during bone removal or crown separation. This is important for optimal healing of the surgical site. We readapt the flap and start the suturing process. Always enter the tissue at a 90-degree angle, and we should have a thickness of about 2 to 3 millimeters to prevent tearing of the tissue. This is the first suture. Second one. And finally the third suture. Okay, after suturing, now we clean the teeth with a wet gauze and clean the mouth. This is important for patient comfort, as it will not be able to rinse her mouth for about 24 hours. After that, we place a piece of gauze on the plate and press it firmly with our fingers for about 5 minutes. This is to prevent blood collection and prevent hematoma formation. After finishing the operation, we instructed the patient to use ice pack on her face for 4 hours, put it for 10 minutes and remove it for 10 minutes. This is in order to reduce the amount of edema, and we prescribe dexamethasone ampoule of 8 mg 1 by 1, and we prescribe analgesic for the patients. The palate have a remarkable healing ability, and this is the healing picture after only 10 days. So I hope you enjoyed the case, and please like the video and subscribe for future videos. Goodbye.